My name is Joe Nicholls, and I'm the Chief and General Manager of the Community Safety Department. I have the privilege to be leading the men and women of the city's emergency management, fire, and paramedic services. Our mission is to protect our residents and keep our community safe. We do so by providing emergency and non-emergency response of fire and paramedic services, while our emergency management section works to build a disaster-resilient community. The Fire Services Division delivers services in compliance with the Fire Protection and Prevention Act. This includes fire prevention and public education, and fire suppression, which includes several specialized technical rescue disciplines such as auto extrication. Responding from 4 career stations, 1 composite station, and 19 volunteer stations across the community, our fire service is one of the 3 largest composite services in Ontario. Supporting the safety of our community is something that Fire Service does through its education and prevention section by conducting inspections, fire plan reviews, and investigating fire code complaints. Our fire training section ensures that firefighters are trained to appropriate standards through the development and delivery of regular training throughout the year, which includes recruit training, officer development, emergency care, equipment operator training, fire suppression, and fire prevention. Our public education programs are aimed at reducing the possibility and severity of fire through targeted education programs with a focus on disadvantaged and vulnerable citizens. The Fire Fleet section provides logistical and maintenance support to the 24 stations throughout our city, ensuring fire vehicles, equipment, and buildings are maintained and repaired in accordance with applicable legislation, regulations, and policy. Our Paramedic Services Division provides mobile health care, delivering performance-based emergency medicine and health services in compliance with the Ontario Ambulance Act. We provide both advanced and primary care paramedic levels of services along with health promotion and care transitions community paramedic programs. It is important to note that 50% of our paramedic service budget is funded by the province through a land ambulance service grant. Utilizing a centralized deployment model, about 70% of our ambulances are deployed out of the Lina Lee Loan Centre in Azilda, where the vehicles and equipment are prepared by logistical staff. Having logistical staff clean, manage, and maintain equipment and fleet allows paramedics to arrive for work, get their fully equipped ambulance, and deploy into the 5 city core stations for the remainder of their shift. We also have an additional 5 reporting stations located in former lower tier communities. To be cost effective, paramedics cohabitate with fire in 9 of our 11 stations. Our paramedic training section develops and delivers programs including continuing medical education and orientation for new hires, as well as ongoing skills development. The professional standards section provides quality assurance oversight, conducts investigations, and service delivery audits aimed at improving patient safety and reducing risk. They also represent our paramedic service within the healthcare community, locally, provincially, and at a national level. A newer initiative, but one that has made an immense difference within the city, are our community paramedicine programs, where paramedics in non-traditional roles deliver 2 LHIN-funded programs providing home visits, clinical interventions, and preventative health initiatives within the goal of improving quality of life. The emergency management section provides leadership, guidance, and direction to community stakeholders and city departments working towards a disaster-resilient community. This section is governed by the Emergency Management and Civil Protection Act. Through the next 4 years, the Community Safety Department will be engaging Council on some important issues, including regulatory changes in the fire services. The Ministry of Community Safety and Correctional Services introduced 3 new regulations in 2018. One regulation mandates all firefighters, career and volunteer, be certified under the National Fire Protection Association standards. While the current government repealed this regulation, it is anticipated it will be reintroduced in some form in the future. Council needs to be aware of the implications these regulations may have for our community and be positioned to be able to adopt and comply with any new regulations on firefighter certification. Late in 2017, the province introduced the Strengthening Quality and Accountability for Patients Act. This legislation amends the Ambulance Act, allowing paramedics increased flexibility to deliver alternate care options to our patients. This legislation allows paramedics the ability and authority to refer patients to places other than hospitals. A multi-year community safety station revitalization plan is required to address the long-term sustainability of our stations as it relates to size, location, and health and safety of our staff who occupy these facilities. The plan will identify and develop various options relating to renovating, consolidating, and building new stations for Council's consideration. Thank you for taking the time to watch this video. I look forward to working with Council over the next 4 years, ensuring we have a safe and vibrant community.